I will be speaking today about critical care, architecture, and urbanism for a broken planet. First, I want to quote from the abstract that I sent early March 2020 when I was still hoping to be able to travel to Johannesburg this year in April. In medical terms, critical care, also known as intensive care, is a specialized branch of medicine dedicated to diagnosing and treating life-threatening conditions. For this lecture, this term is borrowed to address the planet's life-threatening condition and to address the climate catastrophe. As we are moving into the global present of pandemic times, with the death toll of the coronavirus rising, with coronavirus patients exceeding intensive or critical care space, with social distancing and lockdown increasing domestic violence, it is not easy to speak about care. First, I want to share with you a number of images that have become globally representative or global references to how we imagine the infected planet. This image shows that discomfort you're feeling is grief, published by the Harvard Business Review, March 23rd, 2020. The next image shows the armed forces of Malta soldiers in protective clothing against possible coronavirus infection with rescued migrants. This one shows migrant workers travel on a crowded bus in Ghaziabad on the outskirts of New Delhi on March 29th. This one shows National Nurses United in the US, March 2020. I will be speaking today from the perspective of research connected to an involved urban curatorial project called Care and Repair, Vienna 2016, and an international research investigating architecture for the crisis-driven 21st century through the perspective of care, titled Critical Care, Architecture and Urbanism for a Broken Planet. If I were to start researching today, the focus would necessarily have to shift with the aftermath of the global presence interconnected crises unforeseeable. Why care? I'm turning here to a definition provided by feminist care ethicists and political theorists Joan Tronto and Berenice Fisher in 1990. On the most general level, we suggest that caring be viewed as a species activity that includes everything we do to maintain, continue, and repair our world so that we can live in it as well as possible. The global present is characterized by a general crisis of care. Owed to what Nancy Fraser calls critical separatism, the economy, ecology, labor, and social life are separated from each other in the diagnosis of care. And this is what makes working against the crisis even harder. So what we need to do, and specifically do in architecture, is connecting the interconnected crises of economy, ecology, labor, and social life with each other. Literature that helps us to think about the entangledness, the interconnectedness, and the interdependence of bodily, social, and environmental care is in the following books. Arts of Living on a Damaged Planet, edited by Anat Singh, feminist anthropologist, together with others. The 2015 Who Cares, published by Joan Tronto. Maria Puig de la Bella Casa's widely circulating Matters of Care, Rob Nixon's Slow Violence and the Environmentalism of the Poor, and Françoise Vergès' Feminisme décolonial, which is currently being translated into English, that highlights in particular the racialized and sexualized dimensions of reproductive caring labor. As we all know, architecture is indispensable for the life, well-being, and survival of humans. Anybody relies on architecture as a sheltered space to eat, take care of bodily needs, sleep, rest, and to interact with each other in corporeal, emotional, and intellectual exchange, providing a home for these basic activities. To inhabit a home that allows for the performance of these everyday acts tied to social reproduction is called living. Of course, the concept of living extends far beyond homemaking and the household. However, it is crucial to draw attention to its verb, to live, which implies two critical aspects: to occupy a home and to maintain oneself. To do both is to be alive, aliveness. Looking at the fundamental task of architecture, which in the broadest definition possible is the provision of shelter, we come to see that architecture and care are co-implicated. Such care provided through architecture is indispensable to human life and survival. In 2016, Angelika Fitz, co-curator of the Care and Repair Project and director of Vienna's Achitecture Center, we started to work on an urban transformation site in Vienna. Here I only want to refer to one of the more didactic formats that I developed for this project called a care walk, where people were given quotations from feminist and decolonial care theory approaches and then looked for a site within this urban transformation area and connected the quote to the site and then shared with all the participants in the care walk how they thought there were connections to be made and what that meant in ethical and architectural terms for future caretaking for sites within an urban transformation area. Slide 15 shows an installation view of the Critical Care, Architecture and Urbanism for a Broken Planet exhibition at the Achitecture Center in Vienna. The show was on in the year of 2019 with climate crisis, climate catastrophe, and environmental extermination at the forefront of the headlines globally. We focused on presenting architecture that we had researched internationally, and all the examples provide evidence that architecture is actually capable to connect the interdependence of bodily, social, and environmental caregiving, but is also able to work within the interconnected and interdependent dimensions of ecology, economy, and labor without privileging one over the other. Very often, care privileges either health justice or social justice or environmental justice. And our claim is that these different aspects of justice actually have to be connected and addressed in their interdependence. As we all know, and as architectural theorist and practicing architect Peggy Diemer has stated, the history of architecture is the history of capitalism. Capitalism is, of course, the economic system that has led to the anthropogenic climate catastrophe, and therefore we also have to look for ways of counteracting this catastrophe by means of producing differently and by means of realizing architecture differently within the current conditions, as we are not very hopeful that these current conditions of capitalism will be changing or leaving the planet anytime soon. I want to share now two examples that were included in the exhibition. The first example is the Caño Martin Peña Community Land Trust, located in San Juan, Puerto Rico, and realized as the Community Land Trust became law there in 2014. This aerial view shows the Caño Martin Peña, the channel, and also that it is an estuarian situation here. Historically, refuse and debris has been used to fill the channel. At the same time, it was considered an informal dump site, and raw sewage was discharged into it. Regular flooding meant increasing health risks as the communities were exposed to contaminated flood water. This situation became even worse with the hurricanes that hit San Juan in the recent past. This photograph here shows the stark contrast between the local communities and the land they have been occupying since the 1930s informally, and therefore they don't hold land titles to the land, and the financial district, Milla de Oro, which we see in the background of the photograph. The mangrove wetlands that have now almost entirely disappeared were first settled informally during the 1930s and 1940s. Today, with San Juan's financial district next to it, ensuring the residents' rights to the land is more crucial than ever. Joining together environmental and social justice, the legal model of the Community Land Trust makes the communities the collective owners of 200 acres of land. And this is the first time ever that a community land trust has been used in order to an entire informal settlement, making the legal guardians and legal owners of their land collectively, which means that no single parcel of land can be sold off. Here we see one of the community leaders, Sorimar Rodriguez, with many of these community leaders, young women who ensure that also the future of the Community Land Trust will guarantee that there are no negative side effects of improvement, generally called out gentrification. We are now at slide 21. This is the second case study I'm sharing with you today, the Sindh flood rehabilitation in the Sindh region in Pakistan, ongoing since 2010, by Yasmin Lari, together with her Heritage Foundation of Pakistan. Yasmin Lari is Pakistan's first female architect. In the 1960s and 1970s, she built several landmark buildings in Pakistan and is considered a pioneer of concrete-driven brutalist architecture. In the 1980s, she co-founded the Heritage Foundation of Pakistan with her husband, the noticed historian Suhail Sahir Lari. The Heritage Foundation started out with historic conservation projects all around Pakistan. After 2005, Yasmin Lari, by then retired, the Heritage Foundation became one of the world's most successful providers of sustainable, resilient disaster relief structures based on women-centered, zero-carbon footprint structures using bamboo, lime, and mud. And what is really interesting here is that Yasmin Lari could be considered representative for going from CO2 rich architecture to CO2 zero architecture. The image in slide 22 shows flood resistant houses that are built by developing traditional construction methods, for example, by combining mud and lime. Mobile training teams work with the barefoot entrepreneurs as they pass on their skills in a snowball system. And these mobile training teams give instructions for self-building with cost-effective and ecological local materials, whereby the role of women, both in teaching and also in building, is strengthened. The aim is to continuously develop new barefoot entrepreneurs whose skills will be passed on in the snowball system. In the meantime, about 40,000 houses have already been completed, and the dependence on development aid funds has been minimized. Yasmin Lari is extremely critical of the globalized aid industry that actually feeds into the international construction industry. Here, on the contrary, they realize low-cost, low-carbon footprint architectural production, which is healthy and safe. Slide 24 shows one of the highly decorated fuel-efficient earth stoves, which function also as a family gathering space. Al Jazeera did more than one film with Yasmin Lari, and what the films make very clear is that what we all know from our everyday experience with care, that care is never done, that it's repetitive, that it needs maintenance, that it needs repair, that one has to start over again, that one has to check whether care needs have been met or not, that one has to check whether the response to the care needs was actually effective. And this is precisely what she's doing as an architect here. She travels back to the flood, to the Sindh region, to the regions that had been flooded, and makes sure, together with those who inhabit the 40,000 homes that have been built, that the homes actually work, that they're actually flood resistant, and that they perform in the way they should perform. Care starts from the given. I think it is important to understand that our bodies and our environment are not separate from each other, even on an infected planet that we live on today, not just an environmentally broken planet. Our bodies are our environment. We ingest, we inhale our environment, but we have, as humans, also impacted largely and turned it into a broken environment. Architecture shelters our bodies, but architecture is also fundamentally part of the environment, which makes us understand that care through architecture needs to address bodies and environment in equal parts. Caring architecture is architecture that cares for life's earthliness, that cares for the earth as an inhabitable planet, and that cares for the dignity and sovereignty of life and land. And I suggest here that care be understood as a provocation, an invitation, but also an instruction to architecture.